Hi, thanks for being here today for the PRIMA Indonesia Study Procedures Training. I'm Sophie, the Clinical Trial Monitor for PRIMA from Menzies in Darwin, Australia. This study procedure video will go for approximately 30 minutes. We will go over study conduct and procedures so you can start the trial with confidence. Please remember to practice within GCP guidelines. Patient safety is the priority. Hemolysis is a risk in participants taking primaquine. You must be aware of the warning signs of a hemolytic serious adverse event. This is covered in the safety video which follows after this. But record all adverse events and report serious AEs within 24 hours of notification. What is the rationale for the study? Well, there's a very high risk of P. vivax parasitemia following P. falciparum infections, and even with highly effective ACTs, the greatest risk of recurrence after falciparum malaria is P. vivax rather than P. falciparum. There is a case for universal radical cure following P. falciparum diagnosis. Current evidence is that low-dose primaquine, a total dose of 3.5 milligrams per kilo, only has moderate efficacy. In addition, 14-day primaquine treatment has low effectiveness and adherence. The IMPROV study, which was completed in 2017, showed that high-dose primaquine treatment, a total dose of 7 milligrams per kilo, given over 7 days, which works out to 1 milligram per kilo per day, is effective and most importantly safe in G6PD normal patients. The primary objective of the PRIMA trial is to assess the safety and efficacy of a 7-day course of high-dose primaquine treatment in preventing recurrent symptomatic P. vivax parasitemia in G6PD normal patients following uncomplicated P. falciparum malaria. Secondary objectives are to assess the efficacy of a 7-day course of high-dose PQ treatment in preventing recurrent symptomatic and asymptomatic P. vivax and P. falciparum parasitemia, and to assess the relationship of hemoglobin and G6PD activity over time. The study has 3 study sites: Ethiopia, Indonesia, and Bangladesh. Bangladesh was able to commence the trial pre-COVID in August 2019, and they completed follow-up in January 2020. Before study enrolment starts, a pre-study survey to find the G6PD normal cutoff must be completed. The survey will involve a total of 30 volunteers. They will be male adults who will complete a separate consent form for this element of the study. They must be negative for malaria, no fever, no surgery including dental treatment in the last 6 weeks, no blood transfusions in the last 6 weeks, 1 finger prick sample to measure G6PD activity will be using the biosensor, and there's no further follow-up required. From those 30 adult volunteers, we will calculate the adjusted male median using the data entry Excel form, and this will be your cutoff for enrolment into the PRIMA study. You won't be able to start enrolment into PRIMA before doing the pre-study survey. And we will supply you with the pre-study data log and the Excel file prior to commencement. There are 2 arms to the PRIMA study. The control arm, which will have routine falciparum care with schizonticidal treatment, plus a single dose of primaquine. And we will compare this with the intervention arm, which is schizontocytal treatment plus a 7-day high-dose primaquine regimen. This equals 1 milligram per kilo per day. So the schizontocidal treatment for falciparum patients in Indonesian is DHA-PIP administered once daily over 3 days. All doses will be supervised, and in the intervention arm, the doses will be given with primaquine and always given with food. Primaquine comes in 15 milligram doses. The control arm will have a single dose of primaquine, and the intervention arm will have 7 days of high dose primaquine starting on day 0. We will provide a chart for dosages that we have already figured out the medication schedule. So for example, a 70-kilo man will have 4 tablets daily for 7 days. The days are day 0 to day 6, and all doses supervised and all doses given with food. Before entering the study, a potential participant must meet the following inclusion criteria. P. falciparum monoinfection, no mixed infections, as diagnosed with microscopy. A fever of greater than or equal to 37.5 or a history of fever in the preceding 48 hours. This means that the participant can report a fever from the earlier 2 days, but they may not have a fever on presentation to the health centre. They must be older than 1 year and G6PD normal as defined by the SD biosensor at greater than or equal to 70% of the adjusted male median for each site. As discussed earlier, the pre-study survey will establish this exact number for your reference. They will also need written informed consent. You will already be familiar with the process of taking consent and providing all relevant information, but we will cover this again later in the video. The participant must be able to comply with all study procedures and timelines. The potential participant must be aware that the study involves returning to the clinic over multiple time points and blood collection, which can be uncomfortable for some people. In addition to the exclusion criteria, you must check for the following exclusion criteria. This means the participant cannot be enrolled in the study. These include general danger signs or symptoms of severe malaria. This could be one or more of the following: impaired consciousness or coma, generalized weakness that the patient is unable to walk or sit up, failure to feed, convulsions, respiratory distress, or a systolic blood pressure of less than 80 or 70 in children. Clinical jaundice, history of hemoglobinuria, abnormal spontaneous bleeding, or a history of anuria or oliguria over the last 24 hours, and hypoglycemia less than 2.2 millimoles per litre. They are the general danger signs for severe malaria. Other exclusion criteria is anemia, defined as hemoglobin less than 8 grams per deciliter, pregnant women as determined by a urine pregnancy test, breastfeeding women, known hypersensitivity or allergy to any of the drugs given, any use of drugs with hemolytic potential, or a blood transfusion within the last 4 months. This is a slide showing the process of screening and randomization. So after screening for inclusion and exclusion criteria, you will know if the patient is eligible or not eligible. If they provide informed consent, they will then need to be randomized into either the control or intervention arm. The randomization envelopes are in numerical order, so only open one at a time and take from the next envelope in line. The consent form in English language is shown here. The consent form should be translated into the appropriate language of your area. Adequate information of the study must be provided verbally as well as here on the written consent. Please ensure participants have comprehended the information satisfactorily and you respond to any questions that the participant asks. Ensure that participants are aware that declining to enter the study will not prevent them from receiving the normal standard of care and that they can withdraw from the study at any time. The participants must personally sign and date the informed consent form. The study staff cannot sign or date for the participant. Only the name of the participant can be written by the study staff. Finally, a copy of the signed consent form, both the participant information sheet and the informed consent form, must be given to the participants. The screening log is one of the required documents to maintain the data integrity of the trial. The screening log can help identify generalizability in the trial and reduce bias. So every patient who is screened for entry into the trial will be recorded on this log. In addition, there is a delegation log for staff. The delegation log ensures that staff working on the trial are qualified and experienced to ensure safety of participants and integrity of the data. Staff will be delegated by the site PI and they confirmed by site personnel with a signature. The subject ID log is used for subjects or participants who are enrolled into the trial. This is the only log that contains the patient's names and links the patient with his or her subject number. Their contact detail is also recorded on this log. This log should be kept in the investigator site file and must not be moved out of sight and must be securely locked away at all times. Here is a summary of the follow-up schedule for the PRIMA trial. After randomization into either the control arm or the intervention arm, the participant will be followed from day 0 until day 63. So day 0 to day 2 will be supervised treatment shizontocidal for the control arm and shizontocidal plus primaquine for the intervention arm. After that, only the intervention arm will return for their supervised primaquine treatment up until day 7, when both treatment arms will return for follow-up visits weekly. The enrolment procedure on day 0 is to fill out the day 0 visit in the CRF. This includes signs and symptoms, medical history, concomitant drugs, and any demographic information. On day 0, 7.5 ml venous blood or 450 microliters of capillary blood will be extracted from the patient, and the treatment according to the arms of randomization, which is shizontocidal treatment, DHA-BIP plus single dose primaquine under observation for the control arm, shizontocidal treatment DHA-BIP plus first dose of primaquine under observation for the intervention arm. On day 1 and 2, both arms will return to the clinic for supervised treatment, symptom questionnaire and medical exam, capillary blood collection for microscopy, and on day 2, a G6PD measurement. Participants in the intervention arm will be reviewed daily and receive supervised primaquine treatment. Participants will be screened for any evidence of hemoglobinuria, dark urine, or adverse symptoms. If there are any clinical concerns of hemolysis, a capillary blood sample will be taken for hemoglobin measurement. An aliquot of the sample on day 6 will also be used to confirm drug levels. Day 7 and weekly until day 63, both treatment arms will return to the clinic for a symptom questionnaire and medical exam, capillary blood sample for microscopy and hemoglobin, and on day 7, 28 and 63, G6PD testing and an aliquot for serology laboratory analysis. All participants with a fever or symptoms indicative of malaria will be asked to return to the same health centre as on enrolment. A symptom questionnaire will be completed, a brief physical examination undertaken, and a blood film will be examined for malaria diagnosis, which will be read immediately. In those patients identified to have recurrent parasitemia, a 7.5 ml venous blood sample will be collected, hemoglobin measured, and the remaining blood will be stored in an EDTA tube for further analysis. The participant will have normal treatment of parasitemia and will be withdrawn with no further follow-up in the PRIMA trial. In this case, it is necessary to complete the final status form here on the right-hand side on the screen, which just needs to have recorded what was the participant's status and why did they complete the study. This was the study procedures and follow-up for the PRIMA trial. The next videos in the training series are safety reporting, lab procedures, and REDCap data entry. Thanks for listening and feel free to get in touch with us here at Menzies.